Good morning, I'm Dr. Janet, resident of urology. First, I would like to thank the organizing committee for this opportunity to show our study at the European Congress of Urology. I'm going to present the stone fragmentation results of a randomized, double-blind, placebo-controlled clinical trial using hydroxycitric acid adjuvant to shockwave lithotripsy therapy in patients with calcium stones. I have no potential conflict of interest to report. Extracorporeal shockwave lithotripsy is a minimally invasive treatment and is a first-line treatment for radiopaque stones of about 1 cm. However, there are many factors that can influence stone fragmentation. It is essential to optimize the fragmentation results of extracorporeal lithotripsy through the use of drugs or food supplements in order to reduce the number of sessions and avoid the use of more invasive treatments. The aim of this study is to demonstrate the efficacy of a food supplement with hydroxycitric acid associated with extracorporeal lithotripsy on stone fragmentation. Fagolitos Plus composition consists mainly of hydroxycitric acid, magnesium, and pyridoxine. This randomized, double-blind, placebo-controlled multicenter study includes 79 patients with radiopaque calcium stones with a size between 1.5 and 2 cm. Exclusion criteria were to take drugs that influence urine pH or urinary lithogenesis, to take anticoagulants or antiplatelet drugs, urinary tract infection, or contraindication for extracorporeal lithotripsy. Patients receive 2 doses per day for a month before extracorporeal lithotripsy of Fagolitos Plus in group 1 or placebo in group 2, and 1 dose per day for 6 weeks after extracorporeal lithotripsy. Stone fragmentation is evaluated by CT 6 weeks after extracorporeal lithotripsy in both groups. There were no differences between the groups in the body mass index of the patients, the stone area, or the Hounsfield units of the stones in CT. There were also no differences in the energy applied to the stones. In terms of adherence to treatment, it was 94.9% in the control group and 90% in the experimental group, with no significant differences detected. The main efficacy variable was stone fragmentation, defined as you can see in the table. In the analysis of stone fragmentation, we obtained significant statistical differences. Every patient in the first group presents some kind of fragmentation. On the contrary, 17% of placebo patients failed to achieve fragmentation. 53% of the patients present some kind of adverse event related to extracorporeal lithotripsy, with no differences detected between groups. Based on our results, the adjuvant treatment with Fagolitos Plus in patients with calcium stones for whom extracorporeal lithotripsy has been indicated optimizes stone fragmentation. We recommend the use of Fagolitos Plus in patients prior to shockwave treatment to improve stone fragmentation and, therefore, improve the effectiveness of extracorporeal lithotripsy. Our group continues recruiting patients in order to increase the study sample and reinforce these findings. Thank you for your attention.